Hi guys. Alright, so I wanted to just kind of do a kind of what's going on with Maddie. Um, I don't think I've done a full update in terms of what is going on. So, as many of you guys know, she was in the hospital at the end of October twice. Once the first time they thought it was just a virus, and then come to find out, it was a UTI that wasn't found until a couple days later. Now, from all of that, they have found that there is some draining issues with her kidneys. Her kidneys are misshapen, and she has kidney reflux. Well, they're pretty sure. Like basically, like I said, everything is pointing to those problems with her kidneys. But the main thing that they need to take care of right away is, I want to say it's the kidney reflux and the draining issue. They're going to take care of basically all in one shot. Because of the fact she's losing weight, this whole ordeal, she started off at 10 pounds 3 ounces, and as of yesterday she was 9 pounds. So we are, to lose a pound, she actually weighs less than she did at her 1 month. So I'm kind of upset because it means like for 2 months, all that gain that I made with, my breast milk doing so good, now we're back. So that's why they want to do the surgery, to put it in the tube so we can fix the problem. And I just noticed here, you can see the cracks on my ceiling. Ooh. It's an old house. It happens. So she's going in Christmas Eve at 1:30 to have the tubes put into her kidneys, so that way it will empty out properly, and hopefully it will fix this problem. There's two ways that this surgery is going to be canceled / postponed. One is if they do the ultrasound, and her kidneys are not inflamed, and that they believe that just going to a different antibiotic for short term, like to get her until spring to do the surgery, then that's what they'll do. Her doctor would prefer to do it in the spring when there isn't the flu and all that's going around. So there's that, which is the best case scenario. The second is if somebody in the house is sick, because of the fact that they don't want her getting sick after the surgery. So that's kind of where we're at right now. It's been very stressful on mommy. I'm having a lot of mommy guilt about it being on Christmas Eve, because that means her, Tiny and Mikey won't have Maddie there for Christmas. It's my dad's birthday. I've also had some family saying that I'm being selfish, that, I should try to, pick a better date. And what a lot of family isn't understanding, I have no FMLA left. I do get back some of my time at the end of January, because it's when I first used it. So I will get back some of it, but I can't, we might not be able to wait. We might even go in on the 19th and be told, oh no, we're doing emergency surgery right now. There's not much I can do about that. That's when I look at it as it's in God's hands. So I'm okay with the idea of it being Christmas Eve. I've kind of come to terms that it's okay. The kids would rather have their sister healthy and happy than not have her around. because there is the possibility of her kidneys failing. It's not out of the possibility. You know, the infection, you know, can get worse. It's, you know, she's already, I don't even know how many infections we've had. I think we're up to 5, maybe 6. I don't know. I'm trying not to keep track of that because that's what gets me even more. Like, I don't know if you guys are going to be able to see. I have a stress rash. I get it when I'm stressed out. So that's why my face broke out. Yeah. So, yeah. So we are doing a family picture this weekend because I've kind of kept pushing it off and pushing it off. We're going to do it this coming weekend just in case, God forbid, something happens to her. I'm one that I do better when I prepare for the worst case scenario, which a lot of you guys will say, well, isn't that causing more stress on you? Yeah, but then when everything goes fine, good. And if everything starts to, you know, get unraveled and go crazy, I'm already prepared. I can take a deep breath and go, okay. So, you guys, just if you have any questions about it, I know some people have asked about, like, the soy and all that, soy and dairy. I am completely soy and dairy. Actually, the whole house is, because of, you know, we've cheated once in a while, but Tiny has an intolerance. So, and then I know it's not always the best while you're pregnant. I mean, while you're breastfeeding. I did sneak while I was pregnant, but now that I'm breastfeeding, I don't, and especially with everything going on, no soy, no dairy. I am able to eat broccoli. I am able to eat spicy foods, and it doesn't bother her at all. So it's just no soy or dairy. So yeah. So like I said, if you guys have any questions, you know, put it down below. And just keep her in your prayers that everything is fine and you guys can see a nice bubbly, happy little one. So I'll talk to you guys later, and congratulations to the new BFPs. I don't know if you've put it on YouTube yet, so you know who you are. I'm recording this Monday, December 9th, and you took your test today, so you know who you are. So congratulations, and I'll talk to you guys later.